There has been a push in medicine coming from the government to transition to electronic records. It's been done in fits and starts across the country without a unified system. The impetus to document electronically is good for patient safety. It is detracting from patient care, in my view. And I spend more time than I would like to interacting with a computer rather than interacting with patients and their families. 15 years from now, I'd like to wake up in the morning and drive to the hospital a little later than I do right now. I'd like to walk directly from the hospital door to the patient room, and outside the room, a computer knows what images and what data I need and presents it to me because it knows I'm the physician there. I want to walk into the room, and on a screen that the patient can see and a screen that I can see, we can go over all the results from the previous day together, and I can say out loud what I want to do, and all that's translated into an electronic document. I can spend as much time as I want with the patient. We can look at screens that are scrolling through data that I'm talking about in real time. I can explain what I learned from their MRI scan. They can ask questions. I can leave the room, and that interaction is recorded for me, sent to billing and coding and to an insurance company before I get back to my office. And then the next patient has more time with me. I think the patient interaction with this system ought to be as straightforward and seamless as possible. It ought to be available to patients of all ages with physical and neurological limitations of all sorts. Therefore, it ought to have different interfaces based on each patient. A difficult task, for sure. Having an electronic record follow the patient through care, I think, is one of the goals for the country and healthcare delivery in the United States. We don't have a standard interface by which electronic medical records can access this information, but one day care will improve if that happens. Physician input to programmers, to software companies, will be key in making sure this product meets the safety requirements of medical care. Physicians will have an experiential database that engineers wouldn't, knowing problems and obstacles that need to be solved. There is a communication issue, so getting engineers and physicians in the room together to understand each other is important. In the future, healthcare IT should be there to free me to spend more time with the patient. And that gives me a huge amount more time to spend talking about how to go about treating the disease and what the disease means to them and their family, what treatment would mean, whether they will ever work again, what their quality of life would be. And those are the questions that I feel like I need more time to answer.